Welcome back, everyone, to another episode of Wellness at the Speed of Light. I'm your friendly host, Dr. Stefano Sinicropi. You know I love doing this, and I love nothing more than having incredible guests on the show. And today, I'm telling you, this is one you don't want to miss. You want to see this one till the end. I got Dr. Michael Richman. You heard all about him in the intro. Double board certified on. He's involved in so many different things. He's steeped into lipidology, which is the study of lipids. This man will save your life. Seriously, like this isn't a joke. You guys know how I'm a pretty serious guy. You don't see me joking around or doing anything. So when I say he's going to save your life with the information you get on this podcast, I really mean that. So on that note, let's get to Dr. Richman. Thank you so much for being on the program today.
Wow, I don't know what to say. What an introduction, especially from another surgeon. That's the ultimate compliment, right?
No, absolutely.
Wow,
Listen, what I've learned through my journey of doing the podcast and now getting into all this integrative health stuff, and not just integrative. When we say integrative health, it's not woo-woo stuff. I mean, it's serious stuff. And we
right.
just had a conversation kind of off camera about the need for certain types of screenings, what works, what's not, what insurance companies are paid for, all this other stuff. And so I follow you to get a lot of information, and people should certainly follow you and give them all that information, kind of towards the end. But there's so much nonsense out here in social media by
Right.
non-experts. It is a pet peeve of mine. Kudos to people. You know what? You want to learn about health, you want to read medical textbooks, you want to do all this and that. But I'm not trying to demean anyone or do anything, but if you don't deeply understand medicine, it's really hard to put
Right.
one-offs in context of how it fits into the broader scheme of how we treat patients. Let me ask you a question. It's got to be a pet peeve of yours too, hearing so much misinformation out there. And that's really what I'm all about. I'm really trying to cut through like what's important, what's misinformation, and how do we get people focused on real actionable, steps from experts that are really going to put them in the right direction. What say you?
So I write so much about this on my Substack page, and have, a ton of subscribers, free subscribers, because, I believe in just putting out knowledge and the truth. And, like you and I have the credentials. And I think when you have the credentials, it adds obviously credibility to everything. The
Mhm.
problem is we live in a day today where people don't want the truth. I start a lot of my podcasts or videos that I do, and I say, a lot of you are ignorant. And I don't mean stupid by saying you're ignorant. I say you're lazy. And that's what we're
Mhm.
doing today is we're creating a population of even lazier people who don't want to know the truth and don't look for the truth. And who their experts are chiropractors, wellness influencers. So, the maddening thing is, and we'll talk about an interesting study as we go along called the SAMSON trial, SAMSON, which actually uh, puts everything, it shows people's belief. It's one of the best trials done. It was done 4 years ago related to statins, and it basically shows, and if you want me, I can talk about it right now really quickly.
Yeah,
Because
absolutely.
it applies to this. Because it applies to this. So it was a double-blinded randomized trial in the United Kingdom, and they were all people who had muscular complaints on statins. Okay, and as I said, it's the
Mhm.
SAMSON trial, and so they were randomized a third to generic Lipitor atorvastatin, a third to placebo, and a third to nothing. Okay, and what the purpose of the study was to show the nocebo effect. And the nocebo
Yes.
effect, opposed to the placebo effect, the nocebo effect is you're going to have negative consequences based on your preconceived negative expectations. So, sure as shit, the people who were on generic Lipitor and placebo had all the complaints And the people who were on nothing had no complaints, and it was almost to the decimal point, the placebo and the atorvastatin people. And if you do a deep dive, because I actually talked to one of the authors of the trial and said that, obviously there are politics that are different, but right-wing people still have that idea that it's big pharma and it's a conspiracy and they don't want to make you better. They want to keep you sick. Left-wing people want to do everything naturally and holistically. And if they take red yeast rice, that's going to make them better, not statins. Okay, so this is the best study ever done showing the nocebo effect. And it's real. And you are going to experience negative expectations based on your prior beliefs,
No,
which I think is significant.
no, I think that I mean that's a wonderful study. Thanks for sharing that. I mean, just going back to what you said about it. I mean, listen, we can't help it. It's like you want me on that wall, you need me on that wall. You can't handle the truth. I mean, we got to do that, and it is true. A lot of
Right.
people they want to hear what they want to hear. That's how our biases are. Because if somebody tells me that if I rub pine cones on my bald head and it's going to make my skin look better, I'm going to look 20 years younger. I want to believe that. Obviously, I want to believe that. I also want to believe that there's a magic lamp that a genie comes out of,
Right.
and is going to satisfy all my wishes. So it's really important for us to choose our words extremely carefully when we are, especially like, because I talk about things that are off the beaten path, but I never support anything unless there's corroborating hardcore scientific data, at least from preclinical styles or just the science itself. And I always say, and I don't mean to talk in the third person, but I was like, people ask me, I'm like, it's not because Sinicropi wants it. It's because I'm just telling you what the science shows. It's not because I want it. I'm aware of my own biases. Of course, I want to find
Right.
the magic pill and the magic beans and
Right.
whatever, but it's all based on science. And that's what I love. I mean, you break it down, into the science. And I think you said it just right. Our biases, you nailed it. I mean, that's perfectly exactly right. With the people that lean right versus lean left. I've actually never heard people like just come out right and put it that way, but that's exactly right. You summarized it, perfectly. And they have their own biases. And that's why, like me as a provider, when I'm talking to patients, I really want to get to know them and what backgrounds they come from, where they're from. I
Mhm.
mean, some, like they would never consider going on kind of Western medicines. It's not part of it. So we have to find some happy medium.
Right.
And then there's other people that, for example, like as a surgeon, they want, like people come, they just want surgery. It could be nothing wrong with them. They can't wait to have an operation. I'm like, I don't have one for you. I'm sorry. But in their
Right.
minds, that's that's kind of their biases. So you told me about that study. So let's
I
let's
mean, well,
yeah, yeah,
my
yeah,
biggest thing right
yeah.
now is that, so I wrote a paper that's on my Substack also called Five Things I Learned About Life by Becoming a Heart Surgeon. And the problem is, like, viscerally what's going on now, it viscerally makes me sick. Like just hearing the nonsense that I hear on TV from these doctors who used to be well respected, or from these charlatans.
Yes.
Okay. And it's not like I'm better than anybody else, but I have the ability every day to touch a human heart, literally and figuratively. And the heart is what gives you life. It beats, it's what makes you you. And you can get in the philosophical stuff. As long as your heart beats, there's still hope. You can mend relationships and da da da. But when somebody is has a heart problem, you see everybody's humanity, and they all have humanity, and they're all
Mm.
nice. And as soon as they get better and they're not going to die, they go back to being the same asshole they were before. Okay. And which is so frustrating, because it's like, dude, I saw who you really are. Like, what's your thought process? You're so mean, and you're so angry, and you're so nasty, and I don't want it to be because you need me to save your life. Like, who are you? And, I've had the good fortune of getting to know a lot of people, whether it be a neo-Nazi who had a swastika, tattooed on his chest and brought him in LA County with a stab wound um, to his heart. And it was one of the best saves I've ever had. And on rounds, I'm chief resident and I'm rounding with my junior residents. And he's like looking down at his chest. And I'm like, what's wrong? And he's like, dude, what happened to my tattoo? And I'm like, you know who saved your life, bro? And he's like, who? I go, a Jew. I go, a Jew.
Love it.
And he goes, you're Jewish? And I'm like, yeah. I go, did you ever meet one of us? And he's like, no, man. He's like, but thank you. Fast forward, he owned a gym called Penitentiary Gym and brought me a shirt and clinic. And the guy was like, I'm no longer a neo-Nazi. I'm no longer a skinhead. I was just ignorant. I didn't know. That's and that's the good kind of stuff that I had. But segueing into what I think the most important topic is and what we're talking about today
Mhm.
is heart disease.
Yes.
And the reason I started with heart surgery went in is because one day I was doing a bypass and I'm sitting there thinking to myself, I don't even know how the hell how these blockages occur. They never taught us that, you know, like
That's
in
truth,
medical
truth,
school. Do
truth.
you remember? Like, um,
No, listen, I'm a proceduralist like you, and I'm going to knock myself for a second. So in my book, that's coming out, I just talk about, I had an ignorant phase too. I call myself, it's an ignorant phase. You don't know what you
yeah,
don't know. And
right,
now talking to experts like you, like real experts, like even as a physician, every time I have these conversations, the amount that I learn it's insane. Because we
right,
think we know everything when
right.
it's just we have our own biases anyway. Amazing stories. Keep going,
Well,
please.
no, I mean, I think the funniest thing is when I was studying for the boards, and I'm sure you had this too. You're studying for the boards, and you're like, oh. Been saying this shit for so long and I never really knew what it was. It was just like passed down to me from my
100%.
attending. Like, this is what they meant. And you start laughing and you're like, I said it with such authority to my patients when I was a resident, like I knew what the hell I was talking about, and I didn't know what the hell I was talking about. Sounded good, it was correct, but now I know the true story. So, in any event, in like 2005, I was like, I got to figure this stuff out. And I called a famous lipidologist who's on the East Coast, abrasive dick kind of from New Jersey. And I said, I'm a heart surgeon. I want to learn about lipidology. And the guy hung up on me. And I called him back and he's like, what do you mean you're a heart surgeon? You want, and he spent the next year sending me everything because there's no formal training in it, sending me everything and all the articles. And I wound up learning and becoming an authority on lipidology. So in 2000, I think not 11 or I wrote with him and two academicians in international guidelines with lipoproteins and lipids, how we use it in the management of patients, and have just spent this journey. Basically, I'm the only heart surgeon in the country that does this, going to meetings, and lecturing cardiologists on what they think they know and what they don't know. And basically, kind of my thing is, I don't want to hear from you guys. None of you guys have ever touched an artery, have never touched a heart. It's great to look at pictures, but
Truth.
pictures are just pictures. And you know that from being a surgeon.
Of
You
course.
know, a neurologist or anybody can tell you anything. You know, when you're putting a suture in or something, you know how much pressure you can tie down with the knot. If you put too much pressure, you're going to tear through. None of these guys know that. I mean, I know that because you and I operate on delicate things. But like, if people think like doing spine surgery or brain surgery, it's like, yeah, it's a nothing. It's like, no, no, it's not just a nothing. So I learned everything about lipidology and since I had the creds already by being a board certified cardiothoracic surgeon, um, it lent itself to people understood what I'm saying, and I made this really logical, and there's some facts. So as we know, cardiovascular disease is the number one killer
Mm.
of men and women in the United States. If you total up the next five causes, Doesn't come close. Okay. Um, every 34 seconds, somebody dies of a heart attack in the United States. And pretty much I tell people if you drive by a cemetery, every third, even though we don't have half, three and a half tombstones is a cardiovascular death.
Mm.
Okay. Pretty scary. And and yet nobody really talks about it. People think it's more of a disease of men and not a disease of women, which is nonsense. Okay, because
Mhm.
as many women uh, die as do men, from cardiovascular disease. But the key thing is it's preventable. Now, the problem we get into is people think that cholesterol and you shouldn't reduce it. And, now you see all over the internet, people like high cholesterol is good. Well, there has never been one topic that has been studied as much in medicine as atherosclerosis. And for those of you who don't know, atherosclerosis is the process where the artery narrows due to the deposition of cholesterol into the artery wall. Okay. And that's the key. It goes into the artery wall. And I'll get to that, and I'll
Mhm.
I'll explain that.
Perfect.
Um, and I'll explain that to you. So, the five risk factors for cardiovascular disease, and these are the only five major risk factors, and they just was confirmed again at the American Heart Association meeting, the biggest study ever done. And the five risk factors are smoking, high cholesterol, type 2 diabetes, high blood pressure, and age. Okay. Everything else are minor risk factors. So those are the main things. And um, so when anybody, gets into all this other stuff and, homocysteine or C-reactive protein, it's like, no, they're not. Okay. No, they're not. The thing we can't overcome is age. But what didn't I say there, which is the most important thing, is genetics, okay? Is your genes.
Mhm.
And that's what frustrates me. You can't overcome your genes. And we, for some reason, the cardiologists, everybody seems to forget your genes. Like you could say to me, Stefano, okay, Michael, look what great shape you are. And you look like you're in amazing shape. Oh, but my dad died at 55 of a heart attack, and his brother had a stroke at 66. Logic would say, you're not low risk.
Yes.
Like, I don't care what you say. You're not low risk. Well, I don't have type 2 diabetes. I don't have hypertension. I don't think I have high cholesterol. No, you're not low risk. Okay. So, one of the biggest things is we misstratify people, and we're all worried about is somebody low risk, is somebody moderate risk, is somebody high risk. And the bottom line is, I don't need any of that other than your family history and autopsy studies um, to tell me that atherosclerosis, 80% is genetics, 20% is dietary. In other words, 80% of your cholesterol is made in your liver and in your small intestine, believe it or not, based on your genetics. 20% is dietary. And of the 20% you ingest, you absorb an average person maybe 8 to 10%. So while you could diet away your triglycerides, you can diet if you're pre-diabetic or have metabolic syndrome, yes, you can, diet has a tremendous influence on that, as you know. You can't diet away your cholesterol, okay? And these people who do keto or carnivore, it's like, and I'm saying this crassly, you're going to lose weight eating dog shit if you eat less than you burn off, okay? Now, keto and carnivore destroy your lipid panel, destroy it, okay? And
So let me
yes, you're
let
going
me
to
let me
lose
just
weight.
let me just ask you a question then, because this is
Yeah.
interesting, because I'm always interested on this. So I had Joel Furman on the program, the Eat to Live guy. I don't know if you've read his
Yeah,
stuff,
I've
and
heard
I
of
don't know
him.
if
I've
you're
heard of
in
him.
that camp, and he is so hell bent on the studies that have been done that consistently show that that type of eating is better for cholesterol and risk factors and things like that. I don't know where you come down on it, but we could talk about Joel, because when I said the word, I said, well, some people prefer, carnivore or keto. I thought the guy was going to fall off the screen. He like exploded into just kind of like what you said. Just reminded me of Joel. He was very negative to that. That we could talk, about it more. But let me
But
ask you
there's
about.
not one society. There's not one society. America, the European Society of Cardiology, the Canadians, the National Lipid Association, American College of Cardiology, American Heart Association. Not one who says you should eat keto, and all of them, it's a disaster on your lipid panel. Okay, it's a disaster.
Yes. Yep.
So, and remember, atherosclerosis or blocking of the arteries and here's the problem people have. It's an asymptomatic disease
Right.
until it's not. So if I ask you right now, and you're smart and you're a surgeon, then we'll get back to what I was saying. Um, what is the first symptom of a heart attack?
I mean,
I'm
I'm just,
asking you.
I know you're trying to, yeah, I mean, obviously I probably don't know the answer. People are going to say like chest pain, pain in the neck, pain down the arm, stuff like that. It's probably feeling fatigued or not well, something like that. If obviously this
No, I'm
is your
glad you
area.
said that because you're a really bright doctor and you don't even know it, nor do cardiologists. 50% are dead before they hit the ground. Dead.
Oh
That's
yeah.
the
Oh,
first symptom.
yeah. So the first symptom is being, so you're saying the first symptom is
Is
death.
is dead.
Okay.
Okay,
All right. All
so
right.
the problem is, these guys we hear about, oh, they ran a half marathon on a Sunday. Poor bastard died on a Monday morning. He didn't have high cholesterol. He didn't have anything. We're gonna get to the cholesterol part in a little bit, but it's like, yeah, I guarantee you he did. So, it's the problem is that if you have high blood pressure and you don't take your medicine, you feel horrible. If you have diabetes and your sugars get too high, or that you
Feel
don't
terrible.
feel good.
Right.
Okay. But atherosclerosis is until you have flow limiting blockages, you're asymptomatic. Okay, we'll get to that. But I think it's important that people understand. So 80% of the cholesterol is made in your body. Every cell is capable of making its own cholesterol.
Mhm.
So even when you take a statin and it shuts it down on a macro level, every cell is capable of making its own cholesterol. And we need cholesterol. Okay, we just don't need a lot. And the brain cholesterol does not mix with the cholesterol in the
Mhm.
body. So the cholesterol in the body has a half-life of 3 days. In the brain, it's 6 months to 5 years. Okay. And there's no interaction. So when people are like, oh, you're depleting the brain of cholesterol, no, you're not. Okay. No, you're not. And so that's one of the myths, such that when people are like, oh, if you take a statin and you lower your cholesterol, you're going to get Alzheimer's. Well, published in the Alzheimer Journal in January 2025, a meta-analysis of 55 trials, 7 million people found, I want to say it was an 18% reduction of all-cause dementia, a 21% reduction in Alzheimer's. Okay. 7 million people don't lie, so I don't want to hear that shit. Okay, they just don't know. Okay, so
Yeah, yeah.
now
But was it, so before you get on, because before you get too fired up, so let me ask you what's going around all the time. So these people, they get on Twitter, they get on all this other stuff, these influencers, and they say, you know what, I'm eating, 40 eggs a day, I pound steaks, I don't have
right.
any veg, I just do all this stuff, and they're like, and my numbers are getting better. What do you say to those? I mean, I don't know. I have no idea where they're coming. I just
But
see
there's
I just see
nobody's
this stuff.
numbers. There's nobody's numbers who are getting better. Okay,
I
like
mean, I'll go
like
with you on this one.
they don't. Okay, so they don't understand. So let me explain to you. So I have this little here. Let me grab
Perfect.
this. You're gonna laugh. Okay, so this is my little bottle of Italian salad dressing. Okay,
Okay,
from a restaurant, and this is
beautiful.
oil. This is oil, and this is vinegar. So this is blood and water. Okay, so misconception. Or so let's turn it on the side and pretend it's a tube. It's an artery. Okay, so we need cholesterol. So cholesterol, oil is not soluble in water. So in other words, cholesterol is not soluble in blood. And if I say right now to somebody, Okay, let's get all the blood or represented by the red to the left side, and let's get all the oil to the right side. They look at you like, how can I do it? Exactly correct. So cholesterol is not soluble in the blood. And if you think about it, it's not like a lava lamp like when we were growing up. Remember those lava lamps? Um, the cholesterol, in order to be trafficked in the body, it's driven around in something called lipoproteins, which are spheres.
Hmm.
In,
Yes.
in and inside a sphere is hydrophobic, which is water hating. On the outside is hydrophilic, water loving. And that's how we traffic cholesterol through the body biologically to get it to where we need it and to get it where we don't need it. So when they do regular cholesterol testing and they measure your LDL-C, which is your cholesterol, all they're measuring is the amount of cholesterol in 100 cc's of blood. Okay? Which, if you think about it right now, like, what does that mean? It means nothing. I'm just looking at
Mm.
an amount of liquid that's not soluble in the other. It has nothing. It has zero meaning because things are trafficked in lipoproteins. And the lipoproteins which cause atherosclerosis are all called apolipoprotein B particles. Okay. And so, as I told you, this topic has been studied more than any other topic. Cholesterol was discovered in the 1600s, gallstones, da da da. But fast forward to 1911, a guy named Anchikov in the Russian Imperial Army, who was a doctor, they force-fed rabbits um, cholesterol, and the rabbits developed accelerated atherosclerosis. That's when the dawn of the lipid hypothesis started. Okay. And because they couldn't do it in dogs or rats, they later found that dogs and rats are impermeable to diet-fed cholesterol. They just don't metabolize it the same way, okay, as we do and rabbits do. So that's when they realized that if you feed something, a rabbit, really high cholesterol really quickly, huge amounts, and the amount of atherosclerosis was proportional to the amount of cholesterol fed. Now let's move backwards. This is the most important. The Horus study, Horus, 2013, published. So they looked at 137 mummies spanning 4,000 years. The mummies were Egypt, the southwestern United States, which at that, would be the Pueblo Indians, Peru, and the Aleutian Islands. Okay. And what they found, they CT scanned and looked at their heart. They found that 34% of the mummies, including the women and children vegan mummies from Peru, had significant atherosclerosis.
Mm.
So it's not a disease of men who smoke and eat Dairy Queen and Big Macs. Okay. It's a genetic disease. It starts in childhood and it progresses. And if that, to me, that says it all right there. It's like, listen, these people were the cleanest eaters there were. The Peruvian vegans and women and children had it. Then you move forward to modern times. In 1968, it was published in JAMA. They looked at U.S. war dead um, from the Korean War who died, of battle wounds, but they looked at their coronary arteries. 73% of them had significant atherosclerosis, and 40, I think it was 42, 43% had critical blockages. Okay. Then in 1973, in the New England Journal, it was published looking at the Vietnam War dead. Median age was 22. One third had severe atherosclerosis. Median age 22. So now I go back to you, and I always say this to cardiologists. I'm like, I don't give a shit what your tests say. Autopsies don't lie. Okay, mummies don't lie. This is a disease, it's a genetic disease, and you can't change your genetics. So that's the big problem right now is we don't look at people based on their genetics. And in my book, everybody's high risk. So when you do regular testing, the regular test. You go have your total cholesterol. Myth one, total cholesterol has never been written into one guideline. So if your total cholesterol is less than 200, everybody says, oh, that's great. Who cares? If it's greater than 200, who cares? Because total cholesterol is your good cholesterol plus your bad cholesterol plus your triglycerides divided by 5, as long as they're less than 150. So if your good cholesterol is high, your total cholesterol is going to be high.
Mm-hmm.
And if your good cholesterol is low, your total cholesterol is going to be low. Okay. So nix that out. So what do we look at? Well, unfortunately, we look at your LDL cholesterol. And I developed, which would be this, the amount of cholesterol in 100 cc's. So I developed an analogy and I trademarked it, but it was too much money and everybody was using it in papers and meetings. And I was like, I can't like enforce this. The Richman analogy. And it was this. Is it the number of cars on a freeway that cause a traffic jam or the number of people in the cars? And the answer is it's the number of cars that cause a traffic jam, right?
100%.
If you're on a freeway.
I know exactly where you're going with this.
Okay.
Yeah.
So that's a Richmond analogy. So the freeway is the artery, is the inside of the artery. And we're trafficking, and the people are the LDL-C. So those are the people. And we're driving them around in cars, which are the lipoproteins, which are the LDL-P.
Mm-hmm.
It's just the opposite. The P are the cars, the C are the people. So that's how the body works. It drives it around. And if you can't get the cholesterol to where you need it and where it's going to do harm, it's irrelevant how many people you have. And the lipid parameter that correlates most with major adverse cardiovascular events, non-fatal heart attack, non-fatal stroke, fatal heart attack, peripheral vascular disease, is the number of apolipoprotein B particles, specifically the number of LDL particles. So it's the number of cars. So for example, if your LDL-C, your number of people, the guidelines say, oh, it should be less than everybody, less than 100. So let's say it's 100. Well, you could have 100 people each in their own car. So that would be an LDL-P of 100. You could have 50 people in 2 buses, or you could have 25 people in 4 minivans. They all have the same number of people. One person is high risk as hell, the other person's no risk. Okay? Because the more atherogenic particles you have, the more particles that drive into the wall of the artery. And they go into the artery via diffusion. And obviously, you know what that is, but for everybody else who doesn't, it means in life, stuff flows from where there's a lot to a little. Okay? And once it goes into the artery wall, it triggers inflammation. So inflammation does not occur unless stuff goes into the artery wall. So when all these guys talk about, oh, it's inflammation, it's inflammation. No, it's not inflammation. You don't get inflammation until lipoproteins go into the artery wall. And then macrophages come in and they eat the lipoproteins and they become what's called a foam cell, which is the hallmark of atherosclerosis, and they all coalesce together and you get a plaque. But it's it's in the artery wall. Okay, so we measure LDL-C. Now, if you look at the Framingham 26-year follow-up, I mean, it's crazy. So the axis is LDL cholesterol versus the number of heart attacks. So 80% of people who had heart attacks have the same LDL cholesterol. In other words, have the same people as people who did not have heart attacks. So in other words, by looking at the number of people, your LDL-C tells you nothing because there's an 80% overlap, okay, with the same. So you understand what I'm saying? So like heart attack or no heart attack, 26 years. So what are we missing? Well, we're missing that when you do regular cholesterol testing the regular way, it misses 50% of the population, okay, at least. And that's what the figures have shown, that 50% of the population who has normal cholesterol doesn't. And that correlates with the CDC data, which says 50% of people who survive a heart attack or stroke who come into the emergency room have, quote, normal cholesterol. Well, they don't. Okay. So, first of all, we're missing a group of people. Well, how do you identify every single person at risk? Well, for $100, and insurance covers most of it, it's FDA approved. Medicare pays for it, most insurance. You either have your ApoB level measured or you have your LDL particle measured via NMR, which is basically, an MRI, nuclear. So if you measure your LDL-P, and that's what I do on everybody, it identifies 100% of people who have high cholesterol and misses nobody. So my big thing is like, if you could get the insurance company, and like I told you, it's FDA approved, it's in the guidelines, okay? Like guidelines say everybody who's high risk or moderate high risk should have ApoB or LDL-P measured. But then the problem comes in, they all get into this thing, well, who's high risk and who's moderate high risk? And I look at them and I go, everybody's high risk. Why is it that we're only doing it once they've had their heart attack or their stroke? That becomes the standard of care. But in a low risk patient, we don't do it. Isn't the point to prevent the first one? And the answer is yes. So if we can get people to do a test that's $101, even if your insurance doesn't cover it, at 20 years of age, and identify everybody. I'm not going to say that they're going to take medicine, but they're going to think about it because the American Lipid Association just put out a paper that says basically lower, longer is life. The lower you drive your cholesterol over the longest period of time, the likelihood of having a major adverse cardiovascular event is 2 to 3%. And if you think about it, Stefano, because somebody asked me, what cancers are preventable? Well, HPV vaccine wasn't around when we were. So if you're fortunate to get that, nearly 100% of cervical cancers, 80% of oropharyngeal cancers, and skin cancers, if you don't go in the sun, that's preventable. The rest of them, there's nothing that's preventable. Okay, and we can only screen for 4 cancers. Okay, early screening, colonoscopy, mammograms, low dose CT scanning of the chest, if you're a smoker, and PSA. Okay, but there's no, well, atherosclerosis. You can identify every single person at risk by doing this and miss nobody. And then over time, hopefully people then learn the facts and want to know. But even the people who don't want to, as soon as they have their first friend drop dead, they're all over it. They're like, I want to be on medicine, dude, please. And I'm like, what happened? Well, my buddy died, dude. I should have listened to you all this time. Or I had a guy recently call me who's like, I heard you on TV 10 years ago and I've been wanting to do it. And I'm like, why are you calling me? He goes, well, I'm in the Brigham. I had a stroke last week. And I'm like, okay, so if you identify everybody, so that's the key. So the first thing is lack of identification, and we know how to identify them. And then the second is what all these harmful people on TV or on social media are doing is they don't know the facts of treatment. And, if people don't want to be treated, that's their own gig. Okay. You and I can't make them. But half the problem is you want to save insurance companies billions, you want to cut healthcare by billions, you test everybody at a young age because you identify them. A lot more people are going to go on medicines. They're going to do their due diligence. They're going to come around. You will save people from having to have CT angiograms, which mean nothing. CT coronary calcium, which if you want to talk about, we can, which is worthless. I would never get. And all these stupid tests, which lead to further downstream testing, ultimately a stent, and you're screwed. So to me, like this is so simple. This is so easy. It's a freaking blood test. I'm not putting dye in you. I'm not um, injecting you. It's a blood test. And I don't know any other blood test that provides more information. I don't. And you can tell how passionate I am because it's the number one killer. And we can do something about it, but we don't.
It's honestly, it's 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 crazy. And I've had, and again, this is why I love listening to people like you, where you just take these specific ideas and then you just give a master class on it, right? If I'm like we talked about, the head of insurance company, but if I'm the head of Anthem or I'm the head of like United Healthcare and I hear this, it's a no-brainer. I talk about this, for example, one of the things that bothers me as a spine surgeon, most of the people that I see that have osteoporotic compression fractures have never been tested ever. They've never had it looked at, even though you talk about some people have obvious risk factors. They've never been looked at
Right.
it. And I don't agree with the current guidelines that wait so long because people don't do it. We've scanned people that are 32 years old that have osteopenia, sometimes even, borderline
Right.
osteoporosis. Why with this? And again, DEXA scans are one thing. There's something else called a REMS bone scan. There's no radiation. It's more expensive than the $100 blood test. But what does it save? Like once they get into my hands with 7 compression fractures, the cost to the system is astronomical. You can scan so many people, and avoid that. That's one thing. The other thing that I would say is everything that you mention is exactly why I was so excited about having you on the show. Like, folks, here's a doctor who's dedicated his life. He's a surgeon. He holds the heart in his hands. He's doing all this other stuff. He's learned like lipids like nobody else. He's telling you, go get this test. He's telling cardiologists that the other stuff is useless, and people don't listen. That's why, like, we're so alike. Like, it drives me crazy. It's not like and we're not necessarily inventing these things, even though your analogy was the Richman analogy. Sorry, I'm going to use it too. Don't sue me or anything. But anyway, love the Richman analogy. But whatever. It's like it just drives me crazy because it's like we're not out here saying these things because we want them to be so. Like just so that we say something and it's like,
Right.
oh, it's cool because it's my idea and I said it. It's because it's
I mean,
based on
mummies don't
facts.
lie, right?
By the
Mummies
way,
don't lie. Autopsies
listen,
don't lie.
like forget Shakira hips don't lie. Let's go with mummies
Right.
don't lie. I'm
Right.
fired up now. Now let me ask you: have you trademarked that? That is worth it. Mummies don't lie.
No,
That's amazing.
no. I mean,
I might
but that's
trademark. You
actually
better, you better, you better get on. You better get on the website right away.
we
I
can do
might
it
trademark
together.
it.
I mean, but so the issue is why don't even doctors who know this do it? Well, it for the amount of time that I spend with people, if I don't have, brick and mortars anymore, my company, I do everything virtual and it's informal kind of guidance or consult, and I work with their doctor or whatever. But when I had brick and mortar, the Center for Cholesterol Management, maybe insurance pays you $70 and I spend an hour with everybody. Okay, you can't do that and pay a $70,000 malpractice premium. Okay, like I took no salary for 5 years. None, because you know how little surgery pays, and then I'd run and I'd see a bunch of patients in the office. So the guys who even know how to do this, it's not cost effective for hospitals or freestanding places to have lipid clinics. And then the doctors, it's too time consuming, and then arguing with people who say, "Oh, my liver enzymes are up. My internist says that they're bad," and it's like, you reach a point. But like, let's say you and I could get to the CEO of Anthem, and it's like, and then remember, most doctors don't even know how to manage. They think, oh, you're just going to put you on a statin, and there's so much experience and subtleties and what combinations. But let's say you and I could get to the head of any insurance company and say, okay, we're going to do this, and I'm going to prove this to you. Let's put this in, and let's say, just like with colonoscopy, that it's going to be free because you'll get it from pennies on the dollar from LabCorp, that every 20-year-old gets screened, okay, for LDL-P. And you do regular testing and you do LDL-P, and you'll confirm the data. So for $101, you will identify every single person at risk, okay, who has high cholesterol. Now the goal would be to make it part of, listen, if you want health insurance, that's something they could do now. If you want to get it through the portal, or you want Medicaid, or you want this, you need to have a blood test done. Okay. And then through education, you can educate people on, okay, you can try diet first. You want to try diet for 3 or 6 months, and then understand, we'll do your numbers again. You will save billions in our healthcare system, because it's estimated now that we spend $8 billion on unnecessary liver testing because people have this idea that statins harm your liver. 8 billion. No hepatologist will do a liver biopsy anymore. The head of liver transplant at USC is my best friend, who came from Pittsburgh with Starzl, who was involved in the development of tacrolimus, done over 4,000 transplant, never done a transplant for statin-induced liver damage. Never, not once. Okay, 4,000 transplants he's been involved with. So, you know, you have the opportunity to save them money, but more importantly, this is the only thing that you can save people's lives with. Okay, by identifying them early. Do I take a statin? Hell yes, I do. I have no intention of dying from the disease I treat. I take way more than I need, and I take ezetimibe, which is another reason, because I'm not dying, because we know that if you drive somebody's LDL-P or ApoB that low, we know what the number is from studies to stop progression. So the whole point is, can you slow progression and stop progression? And the answer is yes. Can you cause regression? And the answer is no. But I'll explain that, because that's another thing that you hear all over social media. It's they're not telling you the truth. So can you clean out your arteries? Can you regress the plaque? And the answer is no. If there was a way to do it, just like if there was a way to make people walk, you guys would be at the neurosurgery meeting and it'd be like, hey, dude, don't tell anybody yet. I got a friend. I don't want to spill the secret because there's only, a little bit of the special sauce, not enough to go around, and I got to hit my people up with it. So I'm like, if there's a way to clean out the arteries, we would know. So what regression really is defined as, what statins do. They cause regression by the plaques that are, okay. So the majority of people who suffer an acute heart attack do not have a flow limiting blockage. Okay, they have a 20 or 30%. Somehow over the ensuing weeks or months, but a lot of times over the ensuing week, the plaque volume expands dramatically. You get a necrotic dead core in the middle of it, and you have plaque rupture. Okay, it has to do a lot with smooth blood cells. So by and large, most acute heart attacks, well over 95% of them, are plaque rupture. So regression has to do with decreasing the inflammation. There's no more potent and anti-inflammatory than a statin. So getting rid of the necrotic core and increasing the thickness of the fibrous cap and rearranging the volume of the plaque. So the plaque's not leaving, it's just you're rearranging. So the third effect of statins, which I call the money, which you can't measure, is plaque stabilization. And that's what it is. And there's two COVID trials, actually, randomized COVID trials. People went in the ICU with severe COVID, and despite what people think, people die from COVID, not with COVID. One of the major causes is heart attacks, plaque rupture, because COVID causes insane inflammation. They had people, they put them on statin, people who were either placed on a statin or were on a statin when they went into the ICU, as opposed to people who are not, had a markedly significant reduction in cardiovascular deaths as those who are not on a statin. That has nothing to do with cholesterol lowering. That has to do with plaque stabilization. Okay. And the majority of plaques that rupture have zero calcium. That's why calcium scoring is a joke. I would never get it. Okay, I would never get it. It means nothing because get back, mummies don't lie. Autopsy, atherosclerosis, the autopsies of the war dead don't lie. They have no calcium. A heart surgeon who feels it every day, shit has to be around a long time. It's bone. Bone gets calcified over time. Babies' bones have no calcium. So it's the same thing as lesions in the
Well,
heart.
I
It takes
will tell
forever
you,
to get calcified.
you're talking about like touching stuff. I mean, we do all these anterior, abdominal surgeries to get to the spine anteriorly, man, some of these arteries, man, they're like garden hoses. It's insane
Right.
to move those out of the way. We're just so afraid that they're going to end up with a stent after that. That's why we're so careful with these vasculopaths of doing these anterior approaches. I mean, obviously you could see all their vessels clearly just on an X-ray because of all the damage that's been done. It's
Right.
actually interesting. I like the way that you're framing this because when you're touching these things and you're seeing, I always ask myself, this is random, but it's very much in line. Like I operate on all these patients that have like severe spinal stenosis. So you get all this like growth of tissue,
Right.
from the back. Most of our audience is lay. So, some of the stuff, but there's something called the ligamentum flavum. And then there's these osteophytes that form. Sometimes it's so severe. And I look up on my PA because I'm always fascinated by the things we do. And I'm like, how does this happen? Like, how do you get like what happens? This was a normal canal one day, and now 50 years later, it is just crushed and it's crushing the nerves. It's just fascinating. And a lot of the processes are in that same, kind of category. Before I forget, I love what you're talking about. The statin question is really important because there is a lot out there with statins, and this is not just coming from the lay community. I mean, there's a lot of controversy going back and forth between doctors and stuff like that. Obviously, this is what you do. But I wanted
Mhm.
to ask you, and I mentioned this to you briefly the first time we met, which is I had McConnell on the program, and he's a lipidologist and does all that. I just wanted to get your take on niacin because not I mean not and again just I mean
Right.
from a statistical standpoint from the studies, because I get asked questions all the time, and that's not my that's clearly
Right.
not my sweet spot. But how does niacin play in all this? First of all, do you take niacin? What does
Now,
niacin do? Just explain to people why so much talk
okay.
about niacin, and then how it can or cannot do anything for people that have high LDL particle numbers, let's say.
Okay. So niacin is no bueno. Okay. Um, Niacin originally was developed prescription niacin. Okay. And the one that most people used was Niaspan. It's still available. Um, and we don't really need it anymore. It was a triglyceride drug initially to lower triglycerides. Okay. That's what it was developed for, was to lower triglycerides. So then in the early 2000s, late 1990s, early 2000s, there was this whole thing. There was a study, and it was like 20 people, and nobody reproduced it. It was a weird study, and they apparently gave people high dose niaspan, and it cleaned out their coronary arteries. And like I remember I went to this meeting and I looked at them and I was like, I'm the only heart surgeon there, and I'm like, okay, what a load of bullshit, and I just like call it like it is. I'm like, what? Like nobody else has been able to do this, just like nobody's ever been able to reproduce Pritikin. And if you like do a deep dive into Pritikin, it's nonsense. He chose out his people. Nobody's ever been able to reproduce his results, but be as it may. Okay. So then there went on this whole kick. This and niacin also raises your good cholesterol. So at that time, we thought that your HDL cholesterol, having a high HDL cholesterol, was protective. Okay, that much different than we know today. So great, cleans out your coronary arteries. It shows kind of in 20 people a study, and it raises your good cholesterol. It's got to be good for you. Let's put everybody on niacin. And there's it's one of the most difficult drugs to take, as you know, causes flushing. Um, People are uncomfortable, itching. So then they finally did two big trials. The main one was the AIM-HIGH trial, AIM-HIGH. And the AIM-HIGH trial was, I believe, simvastatin, which was generic Zocor, plus niacin versus simvastatin alone. So the niacin group had way more complications, more cardiovascular events. Yes, it raised everybody's HDL, but they had more complications and more events. So the paradigm slowly started shifting there, and it was like, okay, is this thing really? First of all, is raising HDL even the answer? And that's the first time it's like, no, maybe that's not the answer. Okay, and so it has progressed now where we know definitively in it also does lower your ApoB, so it was like a fourth line. So somebody's on a statin. This is before there were a lot of medicines. They're on Zetia, which is ezetimibe. Then you have them on bile acid sequestrants, if you remember those people that used to put powder in their drinks to lower their cholesterol. Then it was like, listen, I can't get their LDL-P down to where it needs to be. I'm gonna add niaspan, okay? And nobody had a problem with all these other drugs except niaspan. Well, then came full circle, and we realized that number one, having too high of an HDL is not a good thing. Wrote a paper on that. Is too much of a good thing bad? And the answer was yeah. We have found that um, people who have HDL, if you take women, there's a good study that shows women whose HDL is over 80 as opposed to 60 to 80 have a 93% greater incidence of cardiovascular event. So there becomes a point where your good cholesterol becomes pro-inflammatory. Well, we found that niacin, subsequently niacin alone, is an inflammatory mediator, causes inflammation, causes increased number of events. So there's nobody in the lipid world who's mainstream who uses niacin. All the guys who use niacin are the guys like who you're mentioning, who are like, oh, it's worked for me, and I have tons of patients who are on it and you're like, well, why haven't you ever published? They don't answer you. Why haven't you ever published on it? And they're like, well, it's because it's anecdotal, because there's no evidence to show that it does anything. If anything, it increases the number of events. Okay. And it's all out there. Everybody knows. So it's not even in the recommendations anymore. No society.
I would love, not that we're going to do this, but I would love to have you and McConnell on for a little debate. I'm going to start doing these because I think it's just awesome just to have people, and then you're just defend. It's no different in the finance world. The gold
I
bugs
agree.
versus guys that like Bitcoin. It goes on and on. I think it's
But the
really
problem is you got to do the evidence based when a randomized prospective huge
agree.
trials are done, which is the gold standard, and then you have somebody who comes in with an observational or retrospective study like we did during our residency because somebody's like, "Hey, you need a paper," and it's like, all right, and before electronic medical records and the charts are really thick, and you're like, oh, we just did a study of 100 consecutive patients, and you're thinking to yourself, that's bullshit. You did not, and we didn't, because if the chart was too thick, you threw it off to the side. It took too long to go through. Okay, so he's known as a guy who hasn't evolved, and he hasn't, and I have nothing against him personally, but he hasn't evolved and he's not mainstream. Um, and he's become kind of like the butt of jokes, like he
I
inundates
think
you
we
with
should
emails.
again, yeah, I mean, I think it would
Yeah,
be, fun because then that really comes out now 100%.
yeah,
Listen, the studies are what they are, and it's interesting because, when I had Joel on, and we were talking eat to live and like the nutritarian diet. I mean, study after study. I mean, and it's pretty clear that that type of of dieting has been extremely positive for longevity, for like for as far as heart disease and things like that, because it's so studied. So you can quote thousands and thousands, of articles. Let me ask another one because this is what people ask. I mean, these are the questions people ask.
Right.
Omega, omega and fish oils. Talk about those, and what is it part of what you do? Because we want to know what you do.
Yes.
I mean, you already mentioned
Yes.
medicines, and how does it work for people that don't understand why they should be taking omega threes and whatever else you want to talk about. It's a really important topic, and everyone's always
Okay.
talking about this stuff.
So, so there's a lot of misinformation. There's a lot of stuff. So the father of fish oil, his nickname is the Cod Father. Okay. And he invented the omega-3 index. Um, and what the omega-3 index is, that started with the JELIS trial, JELIS from Japan. And they were people who consumed icosapent ethyl, which is basically all EPA. Fish oil is made up of EPA and DHA. Okay. And um, people who took high amounts of EPA and got their omega index over 8 had a markedly decreased number of cardiovascular events. Then the Reduce It trial came out in I think it's a fantastic trial. There are several critics of it. The Reduce It trial was published in the New England Journal. It was a major study and it was approved. The FDA knew what the placebo was. It was mineral oil, and they gave them 4 grams of icosapent ethyl, which is all EPA fish oil, and they had a 25% reduction of cardiovascular events on top of what statins do. And statins lower cardiovascular events 20 to 40%. Okay. So, so omega 3s. First, let's get one thing myth. They do not cause bleeding. Of all the surgeries I've had, I've never stopped fish oil, nor should anybody. They do not cause bleeding. That's a wife's tale. Okay. And
Agree.
so,
Agree
so
100%. I mean, people, they come in just sorry to interrupt, but I'll walk into the room to pre-op my patient, and the nurse says, "Oh my God, doctor, I think you're going to have to cancel. The patient took their fish oil last night." And I said, "We're good.
yeah,
We're
we're
good." I
good.
mark the patient. We go back. No,
Yeah,
no,
good.
no problem. I have just not seen it, in practice. I just want everyone to know. Just a reminder. Even though we're talking very deep medical stuff, this is not for we're not your doctors. We're not treating you. Go to your own
Right.
physicians. Tell them what we're talking about. This is not for medical advice, informational purposes. Keep going.
So, so fish oil in the EPA is the important part, okay? And unfortunately, there's only one company that makes over-the-counter EPA fish oil that I found, which I take. I'm not going to plug them. The rest is prescription, and it's Visipa. So fish oil in high doses lowers your triglycerides. It's a primary triglyceride drug. There are a lot of people who don't believe that triglycerides contribute to cardiovascular disease, but that's not true because people who are pre-diabetic or have metabolic syndrome all have too many apolipo-B particles, and those particles are triglyceride enriched and cholesterol depleted. So in other words, if you have particles that don't carry enough cholesterol, you need a lot more of them. So in other words, you need a lot more cars than buses if they're filled with two different things. So how do you deplete triglycerides? High dose fish oil. And triglycerides are carried by something called VLDL-P, which is one of the bad particles. So you have high triglycerides, you have high VLDL-P. VLDL-P become in a matter of hours LDL-P, which is the 95% of all the circulating bad particles are LDL-P. So how do you want to, if you have high triglycerides, how do you want to hit them? I mean, excuse me, if you have high LDL-P and high triglycerides, how do you want to hit it? Well, you want to directly lower the LDL-P with statins or a combination of statins and whatever. And you also want to lower their VLDL-P, which carry the triglycerides, by taking high dose fish oil. And fish oil also decreases the viscosity of blood. And it also is um, one of the most potent anti-inflammatory agents. And, Bill Harris is the Codfather. You can look him up. Uh, he's a genius scientist, and his company is Omega Quant. Um, and he is the authority, he's the world's authority on fish oil. And I've written about it too, and I've actually lectured, on fish oil. So I'm a big proponent of fish oil. There are um, one of my buddies who's got a big presence on the internet is a legit cardiologist, um, and he's good. He's not a fish oil guy, and I totally disagree with him, and the literature disagrees with him. He just doesn't think it adds anything to anything. But you go to a guy who writes the literature, um, Bill Harris, and you go to a lot of the fish oil experts, but I think it's the EPA portion. The DHA doesn't seem to do anything. Okay. The other thing I just want to bring up about triglycerides, which is interesting, I have a presentation that's on my Substack, and actually I also put it on TikTok about saturated fats. So saturated fats raise your cholesterol, and that's why beef and all that's bad for you. But there is no substance that has higher saturated fat, higher than coconut oil and coconut milk. Coconut oil has 92% saturated fat. Butter's 63, beef is 51. You want to put it in your hair and on your skin? Fantastic. You want to put it in your coffee or cook with it? It makes your triglycerides and your cholesterol go through the roof. And there is not one organization who says you should even touch it. And my talk, and I listed the articles where there's no cardiovascular benefits, but I listed the articles where they're talking about coconut oil benefits. Nothing had to do with cardiovascular, but it was the Filipino Journal of Medicine. It was all these journals you've never even heard of. And it was like pregnant murine rats fed um, coconut oil had more hair growth. And it's like, yep. So that's what the non-industry, that's what industry and the coconut oil talks about. But you want to raise your triglycerides, then cook with a coconut oil or, coconut milk, which is not good for you.
I
Okay.
mean,
So fish oil is good, but it should be an EPA fish oil. The other important thing is when you're taking fish oil, you need to look. I take a little over 2,000 milligrams of all EPA fish oil a day, but if you look, the fish oil may say 1,000 milligrams, all the Costco does, and if you turn it around the side, most of those only have 3, maybe 600 of EPA and DHA. So it's not 1,000 milligrams. You need to look. And the fish oil that's the best is the fish oil that contains, ideally, anchovies and sardines, and that's the EPA fish oil. The other ones contain anchovies, sardines, herring, and mackerel. That's about as high in the food chain as you want to go. Salmon oil is bad for you because as you go up the food chain, there is mercury. Okay. And even though mercury is water soluble, so it shouldn't be in the oil, it is. Okay. You can't purify it out completely. So, ideally you want to take an EPA fish oil. I think everybody should take 1,000 milligrams if you have, a history of cardiovascular disease or you have high cholesterol, 2,000. And if you have high triglyceride, the dose is 4,000 milligram.
well, I'll tell you this, everybody knows me, my staff, if they're watching it or anybody that's around me, especially my wife, I'm kind of a sardine freak. So I always have my sardines. And when I open them up, people just get so pissed off. They're like, you're not going to do this in the clinic right now with the sardines. So I have a whole routine where I pour out everything before I eat the sardine. I just tell people they taste delicious. They just smell
I
bad. It
had
just
him.
doesn't
I had
smell
him last
good.
for dinner 2 nights ago. I was like, okay, I got nothing in my house. I don't really want to order. I'm tired. I took out sardines.
I love sir. No, I eat them all the time. I have them. It's funny. I have this rolling bag. Another thing that I'm a spine surgeon. Of course, I have a rolling bag. I'm not going to carry a
Right.
backpack. But anyway, I always have my sardines in there and all my stuff. And as soon as they
Right.
see me breaking it out, people start running. They're like, "Oh, we can't do the sardine smell." I just try to convince people. I'm like, they're so good for you. And people are like, nah, they smell terrible. They're horrible. I'm like, you just have to taste it. It actually tastes pretty good. Before we. I just want to do one more time. Then I want to do
Yeah.
a little like rapid fire with you. A new thing that I started adding, which is kind of fun because people just they'll just kind of know where you stand on certain things. We didn't talk a ton about this, and you talk about this a lot. It's that the ApoA, stuff. And if you're tested for that, there's specific things you need to do. Should everybody get tested for ApoA?
Nobody should be tested.
Okay.
It's meaningless.
Get
It's
meaningless.
meaningless.
Okay,
First of
completely
all,
meaningless. Okay.
completely meaningless. So here's our current paradigm with HDL. Okay. And it changed remember, ApoA1
Mm.
is the moiety of HDL.
Yep.
Okay. So here's where we stand today. Your your HDL is when you measure it, it's a quantitative number. If somebody is 50, if you're 50 and mine's 60, does it function better? There's absolutely no data. So there is no qualitative test, okay, that that we have. A low HDL is a risk factor because diabetics and people with metabolic syndrome and prediabetes have a low HDL. In fact, a poor man's way of knowing whether you have too many lipoproteins, bad lipoproteins, is your triglyceride HDL axis. So if you put your triglycerides and you divide them by your HDL, and that's greater than 3 to 3.5, that's a poor man's way of knowing that you have too many particles. So how do we know that HDL is bad? Well, there were 4 drugs developed about 10 years ago. They spent billions doing it, all the pharma companies. They're called CETP inhibitors, CETP inhibitors, raised everybody's HDL to 100, 110. They all failed. One had too many heart attacks and strokes. That's why I told you is too much of a good thing bad, and it appears it is. One of them had unacceptable hypertension, and the other two did nothing to lowering events. So our current paradigm is, and it was never, Stefano, it was never a goal of treatment. The original goal of treatment was lower your LDL-C, so lower your people, then lower what's called your non-HDL cholesterol, which is a poor man's lipoprotein. So if you subtract your total cholesterol minus your HDL, that's your non-HDL cholesterol. So then lower your non-HDL cholesterol. And then as an optional tertiary goal, you can try and raise your HDL with niacin. However, we don't know what to tell you to raise it to because there's no data to show that it's going to do anything. Okay, so that's the paradigm. So now the whole paradigm, and what's interesting, you'll find this really interesting actually. So there's a group of people from Italy, Limone, Italy, Limone, and their ancestors have gone out all over. Their HDL, so their ApoA1s are in the single digits. Most of them have, it's like 5 to 15, their HDL. They all live their descendants into the 80s. They smoke, they drink, they do everything bad. They have super HDL. Okay. So qualitatively, it's phenomenal. So there was just a study that was done. Cedars was one of the places, a secondary trial. People who had heart attacks, they were on statins, they were maximally treated. If we give them now recombinant ApoA1 IV for treatments, are they going to have fewer heart attacks than people who we don't give it? Secondary events. And the trial was stopped after 2 years. It did nothing. So there's something more to it that we don't have. So should somebody have an ApoA1? No, because it's not a qualitative test. There's no way, it's meaningless. The other Michael Richman philosophy is this. How do you know if a test is necessary? Well, if a negative result and a positive result are going to cause you to do the same damn thing, it's not a necessary test.
That's true. That is true wisdom right there. I got one more. I want one more because
Yeah.
you mentioned it before. Again, all over the internet, something that I actually don't know a ton about. I just see people talking about this red, the red yeast rice. What's
Yeah.
the what's the di- what is what's the science behind that? Is it real? Is it something that people should be doing anything with? I just see it. I honestly, that's
Right.
obviously that's not really my world. So I
So that
don't
was one of
know.
the
It's
first papers
interesting.
I used I do everything for free like an idiot. I wish I got paid for something, but I used to
That's
do everything
great.
for I used to do everything for WebMD for free. Seriously, I started there like lipid, their cholesterol message board, their blog and everything. So I wrote a paper for them. Red yeast rice, buyer beware. Okay. Real red yeast rice is banned in the United States, but let me tell you what real red yeast rice is. The main ingredient of red yeast rice is monocholine K, which is the product of fermented rice. Okay. Um, and monocholine K is the exact equivalent. It's the same thing as lovastatin, which was the first statin ever developed. The same exact thing. So these people who are taking red yeast rice, when you can get real red yeast rice, they were taking lovastatin from China that's totally unregulated, put in a nutraceutical under a different name. Okay, so it's like I would never take a statin. It's like, dude, you're taking lovastatin from China along with um, the same stuff that they put in countertops that they found in statins from China. Um, the form with all the added, the bad stuff that's in there. Okay, so lovastatin um, it's the same thing. So red yeast rice in the 90s was banned. Remember the act by the FDA that said if something is commercially available as a drug, you can't combine it in a nutraceutical under a different name. So they banned red yeast rice. So all the red yeast rice that was banned coming in the United States had like fruit extract and that, but had no active ingredients. Fast forward, it's coming in illegally. So they have studied it and they've looked at different brands. Some of it has no red yeast, but remember, it's lovastatin, it's a statin. Some of it has none, some of it has toxic levels. Now, there's a new ingredient from the Beijing pharmaceutical company, and the abbreviation is XZK. And in the Chinese, they published it in the Journal of American College of Cardiology, but in the Chinese literature, it showed it reduced cardiovascular events. Is it the lovastatins in it, or it's this, or is it the Chinese data? Because I always tell people, and I'm sure it's the same with yours, the Chinese do some good stuff, but it's all got to be reproduced in the West because they'd also do shady stuff. Okay. And, um, like when they do, C-react, I remember I reviewed a paper for the Lipid Journal, C-reactive protein levels in Chinese kids aged, it was like 9 to 17. And I'm like, short of threatening them with execution, nobody's going to measure C-reactive protein in kids, let alone 9 to, 17. Yeah, the Chinese. So their conclusions from everything is, well, our population represents a different population and should be reproduced in the West. So yes, real red yeast rice does lower your cholesterol, but there has not been any trial, and there have been plenty of randomized trials that show it reduces major adverse cardiovascular events. And and at the end of the day, everybody needs to remember this about medicines, because there's 5 medicines right now that have shown to reduce. We didn't get into it, which is a whole nother discussion. Lipoprotein little a, which is the newest topic. Everybody should have. There's 5 drugs that right now in phase 2 trials lowered your LP little a dramatically. Okay. unless there's data in the phase 3 trials that it reduces MACE, major adverse cardiovascular, they'll never get FDA approved. So just because something plays with a number, if it doesn't save your life at the end of the day, should we be taking it? If it, and it goes, it's the same thing as cancer drugs. And you know that, when you deal with brain cancer, if there's a drug that won't improve overall survival, but will increase your progression-free survival by 2 months, is it worth $300,000 and to give it? And the answer is no. Sadly, no. No, it's not. So the key is, what are the endpoints of these trials? So, I mean, I hope these work, because lipoprotein little a is an genetic independent risk factor for cardiovascular disease. They're gnarly particles. Um, but unless it reduces events, they're not going to get FDA approved. So red yeast rice, stay away from. If you're going to take it, you might as well take a real statin.
Yeah, that's aw- I mean, that's great. I mean, I think that that's like I told the listeners, they're going to get like just so much out of this. It's interesting with the little a that you talk about. There's a lot on the line for some of these pharmaceutical companies that are working on it. I mean, they're really counting on these things to work. I hope they do work. It's great if we can reduce heart
Right.
disease. It's like absolutely like it'll be amazing. But you're absolutely right. And so one of the comments that I want to make, because a lot of people hear me, and I always have to, I always have to qualify what I say. I mean, I have become alarmed at polypharmacy, because I have so many patients. They walk in with their bag. I actually posted, this lady came in the other day. I swear to God, she doesn't know anything that she's taking, and I don't think the people that are prescribing them know what other people are prescribing. She literally had her walker, the walker, the rolling walker, the
Yeah.
basket. This thing was, it was like full. And I started asking her questions. I started pulling out the medicines and say, "Hey, do you know what this does? Do you know what this?" No, they no
A
nothing. And
prescription or supplements too?
it's crazy. She didn't even have supplements. It was just all meds, all
Oh, this
prescription
is
meds.
all
This is
right.
all hardcore prescription meds. And so I think there is a lot of confusion. So I think that the listeners really need to listen. And I do try to frame it this way. Every time I kind of talk about the whole polypharmacy issue, which, listen, it is a problem. It's a problem. I always quantify with medicines can save lives. They've saved millions and millions and millions of human lives. That's not what we're saying, but yet sometimes they're just not used judiciously, and people just pile one thing on top of another without understanding side effects. People get sick from that, and I think then it does hurt the thing. And then you start getting around, well, statins or all this stuff, it's all conflated. And that's why, going back to how we started, that's why it's so important to listen to people like you that have spent their lives thinking about like these topics, because it's critical, because then you really can cut through the noise. Somebody listening to this that is a skeptic of some of the statin drugs or whatever honestly, if they watch this, they're going to come out of it, say, you know what, I need to revisit my ideas of what I had, because the guy is speaking from an area of expertise, and knowledge. Here's the problem, Doc, and let's be honest. The way that you're able to break down these studies, the way the drugs work, the endpoints, in the things, you have a deep, deep understanding. I have a problem because many people that are prescribing some medicines, I'm not talking about statins, I mean medicines. If you,
Right.
honest to God, if I went in there and I did Secret Santa shopper, right? I just go in, no one knows I'm a doc. I'm just the patient. I'll just come in scraggly looking, I don't feel good. I need meds. The problem is, and I talk about this all the time. And you mentioned this with your cardiologist, friends and things like that. If you sat down in an office right now and you looked even at some cardiologist, some internist and whatever, and you just say, "Hey, how does this medicine work? Tell me how it really works."
I don't know.
I don't think that a lot of times they don't know. That is where all the that is where it turns into a big mess, because
I'm kind of abrasive. I kind of like it. Like I have a problem. I have some friends who are cardiologists or my patients, and they're dumb. Like one of my really
Yes.
close friends, I'm like, dude, you are the dumbest. Like you're one of the dumbest doctors I know. And he's like, why do you always have to give me a hard time? I go, because you're a freaking imbecile. And I go, why don't you send, and you don't send any of your patients to me? He's like, dude, because you know way more than I do. And I'm like, I'm not interested in stealing them. He's like, yeah, but you're teaching me everything. And then you go back and you go, hey, my friend is a cardiac surgeon. He's my doctor too, and I know how to do this. So the problem is patients, first of all, don't look up what they're taking. And they are automatically assume because somebody's an MD or a DO that they know what the hell they're doing. And I've also written about this. I've written a paper. If you don't jive with your doctor, find a new one. There are plenty of good doctors. If your doctor won't take the time and listen to you and spend the time to listen to you, guess what? He's not coming to your funeral. Who gives a shit what he thinks? Okay. So I tell
Love it.
everybody,
Love it.
especially cancer patients, oh, the doctor, he's not coming to your funeral. Who cares what he thinks? Go find somebody else because there are plenty of really good, caring doctors. There's also plenty of really shitty doctors. Um, Patients, um, a lot of them say yes, doctor, automatically and trust their doctor. I think there's a major issue with people, again, who are too educated, not in medicine, but think they're doctors. They're total yentas, who think they know. Like my mom's friends argue with me. Like, like, oh, I'm not gonna call. My mom's like, forget about him. Don't even try and help him anymore. But everybody, you need to sit down with your doctor and you need to ask your doctor, why are you on this medicine? Your doctors all, I personally think the best thing to do is, I don't think people should have a lot of doctors. I don't think you need a lot of doctors. Yes, family practice doctors are very hard to come by, but that's why I started my company where I'm like the quarterback. So even though I'm not your doctor, um, per se, we're your family, your doctors, all board certified doctors who make sure that your doctor's doing right by you. So like if a patient called me and said, hey, Michael, I need you to run my hair. I have cervical spinal stenosis, and I live in, the Minneapolis area. And I'm like, guess what? My boy lives there. I'll call him, get you right in. He'll see you, and he's really busy, and I'll run your care with him, and you'll love it because since he can't call you back and do everything, he and I can text during the day, and then I'll explain to you what's going on. Okay. And people love that. And it's not concierge medicine. It's having knowledgeable doctors who are board certified, who are passionate about running your care. And you know damn well, if you call, even though you're a neurosurgeon, if you call a heart surgeon, just like I'm a heart surgeon calling her, they're going to take your call. If you're a neurologist, sorry, neurologist, and you call up a heart surgeon, like, tell them I'll call them back. There's something with being surgeons who have dedicated their life. Like, think about what we've missed in our life. I mean, I'm not married. um, I've sacrificed so much. Would I do it again? I don't know. But to get to where I am, and you've sacrificed so much to get where you are and have so much knowledge, and you're entitled to respect. So when you call another doctor, you get the respect that you're entitled to, and they listen to you because you're talking from a place of knowledge. Okay. But I think when people have too many doctors, it's like too many cooks in the kitchen. Nobody communicates with each other. Nobody knows what the hell they're putting the person on. And like you said, most of these doctors don't even know. Like a majority of doctors don't even know that hydrochlorothiazide raises your blood sugar. So you have a patient who's a diabetic who's constantly having high blood sugars. It's like, who needs a diuretic? There's other choices, dude. There's like,
You know what
open up the book.
Yeah, 100%. Open up the book and learn and be. I have a chapter. I'm just talking about like in it. It's just right on. So one of the main themes of my book is helping people to be CEOs of their own health. And it's just funny how we think alike because you're saying exactly what I say in the book, and that is when you're a patient. Okay. You don't just listen to people because they're telling you what to do. They may or may not know. First of all, you have to find out who they are. Just figure, just really figure out if you're going to
Right.
people that legitimately know what they're doing. It's just like if I'm using a tax person, I want to know if they legitimately know what they're actually doing. But your role as the CEO of your own health is to hire people like you or people like me or people like whoever, Dr. X, hire them to be part of their team. So you hire somebody in your cardiology department, you might hire somebody in your endocrinology department, you hire somebody in your preventative health department.
Mhm.
And then if you don't jive with them or you get the sense that they either don't know
Right.
the information well or they're not that you guys can't have good conversations. It's not going somewhere. Your health is getting worse
Right.
even though you're under their care. Fire them. I'm like, if I'm not doing a good job, if I'm not doing a good job as your surgeon or now, seeing people like in the integrative health, if I'm not doing a good job, there's a lot of great, in fact, I'll refer you to them, if you want that, if it's just not jiving, but it is what you said is the most important part of all of it. You just don't believe. And again, I'm not telling people not to but just make sure that you have the right people on your team. It's your team. It's not our job to lecture to you. We are going to just give you as much knowledge as we've learned, our experience, all those nights we didn't sleep. Thanks for reminding me of how
Right.
much, we gave up. But you're absolutely right. If you don't like your doctor, fire them. That's okay.
Right.
That's there's no different than anything else. If you don't like your plumber, if every time your plumber comes, the
Right.
thing is still leaking, but in the traditional in this world, I talk about it. People going around like just spinning around the drain, like it's the same.
Who cares if you're going to hurt their feelings? It's your
Who,
life.
who care? And people sometimes people come. I know you get this all the time when you talk to patients. They'll come to me and they whisper. They're like, Doc, I feel really bad. I want you to do my surgery because I looked into it, but I don't know how to tell the other doctor. And they asked me for permission. Is it okay that you're going to do am I offending the other doctor's feelings? I'm like, no, they're not. You're absolutely right. They're not going to be at your funeral. They're not.
Yeah.
It doesn't matter. You have to choose your team. You are in charge. When you're the CEO, you're the boss. You are the
Right.
boss of your own health. And that's why I don't let people, you are responsible. You are responsible for figuring out how to get
Right.
yourself where you need to be. Okay. Otherwise, it's like you're going out, you're
Right.
buying the wrong tools, and then you're mad at the tool. Come on. I mean,
Right.
it's
I
your
mean, when I was chief of
responsibility.
a cardiac surgery department, the rule was when they hired me is nobody could write any notes, no other doctor on any of my patients without my permission. Okay. And I had the best mortality results in the state of California as from Anthem for 2 years, but I also lived in the hospital. Okay, and made sure and made them bring, visiting nurses. But I want to get back to like an anecdote, which is so important, what we talked about. So I did a podcast on it, and John Weiss, and I can say his name because he's on the podcast, who's become family. This is a perfect example. So John lives in Atlanta, and he and his wife, I talk to him almost every day. So John um, had went to Emory and had renal cell carcinoma, so kidney cancer, and they missed on two successive CT scans a pancreatic cancer that was this far away. So he has his partial um, nephrectomy, and 3 weeks later wakes up and he's jaundiced. He goes and sees doctors down in Atlanta. They tell him not too much. He goes up to Sloan Kettering and they start and they give him the whole rigmarole. We're going to do pre-op chemo radiation and then you'll probably be ready for resection. But knowing all along, lying to him that he was never going to be a resection candidate. Okay. But just this. And John talks about how angry he is over this. Well, so he gets done with his um, chemo radiation and he rings the bell, and now he knows, what the hell did I ring the bell for? I still had cancer. And when you have radiation, like if you have esophageal cancer and you have pre-op chemo radiation, you've committed to an operation, even if they don't see tumor, and you have a short window to be operated on, because when you radiate stuff, when you go in and operate afterwards, if you don't do it soon, it's like a bomb went off in there. So John was ready to go home, and it just so happened his wife was roommates with the co-founder of my company, Jennifer Martucci, and they were having um, dinner together in New York. And she goes, "We got to call Michael in LA." And said, "Why?" And she goes, "Because he can save your life." And John, they call me, and he tells me the whole story and sends me his CT. And I'm like, and I looked at it and I go, "No, I think you're resectable." I go, "But we got to get this done fast." So I called who I view as the best surgeon in the world, Rick Selby, who's the head of hepatobiliary at USC. Um, and I called him and I said, "Rick, take a look at this." And yeah, it had grown into superior mesenteric vein, and it would be a big deal. He flew out here. This was a Thursday. I talked to him. Flew out here on a Sunday, had surgery the following Monday, had a Whipple, resected the whole vein that nobody would ever do. He called Sloan Kettering before surgery, and Sloan Kettering said to him, to John, because John was screaming, "Our surgeons don't feel comfortable doing such a big operation." And he was like, "This is fucking Sloan Kettering. What do you mean you're not comfortable?" Well, this is big. So fast forward, John is going on 5 years with stage 3 unresectable cancer because of Rick and I. And he had a rough go, not from that, but he had yeast in his blood and bacteria, and had a rough go of it. And he's alive and he's doing well. And John, yes, he says, "You and Rick saved my life and you saved my life." And I quarterbacked everything. But that's the perfect example. Just because you're going to quote the Mayo, and damn well, probably don't go to the Mayo. Um, and
I didn't say that, by the way. I'm in Minnesota. I'm
I
off
know
the
that's
hook
why I
on that
said
one.
it.
That was
That's
that
why I
guy.
said it.
That was that guy.
It matters who's running the show, and you're going to the doctor. You're not going to the hospital. It could be a rinky-dink little hospital, and there's a reason why the doctor's there, because they treat him amazing, and he has and he's an amazing physician, and he doesn't need 5,000 other people weighing in. Okay, there's a reason. It's funny. I said the Mayo because I interviewed there for cardiac surgery, and this guy Hartzell Schaff, he was the chairman, and it was the middle of winter, Stefano, and I remember it was like 20 below, and I raised my hand, and they're interviewing, and I go, "Dr. Schaff, quick question." I go, "Couldn't the Mayo brothers stop in Minneapolis? Like, there's nothing here." And he goes, "I guess this place is not for you." And I go, "Seems seems to be that way." And I'm thinking to myself, why does everybody want to go to Mayo? This is like freaking God's country, and it's freezing, So like, I always laugh about
Six below
the
this,
Mayo.
this morning, it's six below,
Yeah,
this morning, just walking outside, nose hair is freezing. It's just,
right,
it's
right.
just, it's what we do. You know what? You just hit on something. I talk about this, just really two topics, and then we got to kind of wrap here,
Right, sure.
but two awesome topics. One, it's like this fascination with the name of the institute. You want to go to the best people that are going to provide you the best care. It doesn't matter. Like I said, like it's so important for people to understand that it's the person that's ultimately going to make the decisions. And you do want to make, honestly, and I see that. And again, I'm not trying to knock anyone, but the people that are the best, they can make a lot of the decisions to move forward with surgery and to help people and do stuff, and they don't have to hem and haw for 7 months trying to figure out if they're going to do your guy's
Right,
operation. They just know. They know from experience. They know from a feel. They know from being there, and they're also confident in their own skills. And that is so important, especially when you're going to see a surgeon. I can't explain. That's a whole other, discussion. But the other thing that I talk about constantly, the general public has no idea. Like, they don't see this. They think a doctor is a doctor is a doctor. Not everybody. There's a lot of people that do it, or they think, but they don't understand that the gap between the best doctors and the average to poor doctors, it's so massive. It's the difference between a high school shortstop and Derek Jeter, prime Derek Jeter. Seriously.
Totally.
That's the difference. It's a lot of times it literally is the difference between walking and not walking, having pain and not having pain, life and death, all these different things. And again, it is not. I'm at a point in my career I can start talking about some of these. And listen, we're not perfect. I'm sure you've had operations that didn't go the way you wanted to. And I mean, that's just that we're not saying that.
That shit happens.
Shit happens. Unfortunately, people don't want to hear that. No one, patients they don't want to hear shit happens, but it happens.
But that's not malpractice.
That's but stuff happens. But the difference, it's just so dramatic and so massive. And now, like with social and stuff like that, just because you say you're the best doesn't mean you're the best. So like you have to actually be. It's just a whole. Anyway.
Well, I think.
That is a topic that I like. Literally, that's an entire show. That's a white paper. That's a book, for God's sake.
Well,
right?
Here's like the three things that I think. Here's how you know a good doctor. Number one, they're not afraid to say, I don't know. I say all the time, I don't know. Like I am so like the way I am now is like I'm with my patients. I'm like, how the hell would I know that? Like nobody knows that.
Thank you.
Anybody gave you an answer is like full of shit. Like I don't know. Love that. Number two, before they had phones, remember we used to like these giant textbooks here, the 2000. I would in my office bring in a textbook and read it with the patient and sit there and I'm like, and they start laughing and I'm like, I don't remember. I got to like read. You want me to sit in my office and pretend? I go, so we'll read it together. I'll read it out loud, and they love that. Okay. And then the other doctor, which kills me, is everybody who I know goes to Cedars-Sinai, which is a great hospital, but still, people like to catastrophize everything. My doctor said it was the hardest operation he's ever seen, and he's never done one like this. And I turn to him, I go, horrible doctor, horrible surgeon, and you're in deep shit with complications. Because if that is true and he hasn't seen it, he hasn't done enough. And if this is the worst case he's ever done, God help him, he didn't train in the right place. Okay? You want every operation to just be the same, that you do it the same way. Every operation, you don't reinvent the wheel, as you know, and you have good results and you have humility and you have empathy and you have kindness, just like you took the call before. You're not on call today and you took a call because guess what? That's who you are. No other profession would do it. If you needed a lawyer, they wouldn't do it, like sit in jail all weekend. But we have been trained, and unfortunately the newer generation is not like that anymore. Which makes me sad, that they don't teach that. But we've been trained where you need to be available and you need to have no ego, to bury your ego, because at the end of the day, we all bleed red and we all poop brown and we're all the same. Okay. We studied harder. We worked harder. We were very dedicated, a lot of positives, a lot of negatives, but there is so much reward that comes from it. And there's no greater gift than saving somebody's life.
Listen, I'm going to say a hell yeah to all three of those things that I ad nauseum, all three things you said. The most dangerous, I did a post on this. It went, it was one of the more, like viral posts. I didn't do it. I was talking about, like the Dunning-Kruger effect. It's like, there's no one more dangerous. There's no one more dangerous than people that think they know what they actually don't know. When you're a surgeon or a physician and you have people's lives in your hand, that's the most dangerous creature. I mean, that is that's like the most
RFK
lethal.
Jr., you mean?
Would you say?
The Dunning
Yeah, yeah,
RFK
yeah, yeah, yeah.
Jr. Dunning. I wrote a paper on that
Oh,
on my
did you?
Substack.
That's
Yeah,
awesome. That's funny because
on,
I wrote
on
a post on it. The thing went, wild, and actually, it's interesting because I called it something else, which is why people look at, because when you start saying fancy stuff, people don't get it. But I just called it the reverse imposter syndrome effect. So a lot of people say I have imposter syndrome. I was like, imposter syndrome is of the two dramatically safer, because then people stay within their lane and they're not, that
right.
it's okay to feel like, oh, am I qualified enough to do this, and to be a little bit like, hey, I'm not going to take this surgery on because I haven't seen it. I wasn't trained that way. I don't have the experience. I'm going to bring my colleague in, as opposed to the other side of the thing. The reverse imposter syndrome effect is, I got this. I know it. It's fine. And they think that they know everything, and it doesn't extrapolate. Like, for example, I didn't study lipidology, so I don't just start telling people like from the chair everything about that, my opinion and everything that's there. No, we go to experts like you. We get the textbooks. The other thing that's cool that we both, I do it all the time. I say I don't know all the time, and I don't do the book, I don't do the textbooks, but I go to the screen. I say, hey, let's look up this study together. I think there was a study on your particular thing. I haven't seen
Huh?
that something
Right.
present like this. They absolutely
People love
love it,
that.
beyond like absolutely
Or
love.
if you say, I don't know, but we will figure it out. And my
Yes.
way of practicing is I always, and people initially, I think they're taken aback, but then they understand. Let's go to the worst thing it could be. Okay, like cancer or this, and let's just rule that out. And now we'll go backwards. Okay, because no matter what it is, because too many doctors poo-poo things, and you know that. Like, don't don't worry about this. It's nothing. And it's like, okay. They never read, how many doctors have never read the pathology reports of something that they've taken out and they're missing the fine print? And the fine print is the margins for the melanoma are not centimeter margins, but the guideline, it's 0.3 millimeters. And it's like, you didn't even read it. Like, hello. So, yeah. I mean, everything you're talking about just, it makes me laugh. All these experts, I'm going to take methylene blue. Oh, do you know where methylene blue is synthesized from? No, it's good. It's pure petroleum, just like,
Well, just like a lot of the foods that big food is feeding us. I mean, I say in my book,
right,
I had this one line, and somebody said, "Hey, you really should take that out because you're going to fail." I was like, "What we are eating, like some of this processed food, it is. I mean, they're petrochemicals. Actually,
yeah,
they're actually petrochemicals." So I hear exactly what you're saying. All right. Let me just do. I'm going to do a quick segment. I think people
okay,
are going to like this because honestly, this is the stuff like people want to see. It's just a rapid
right.
fire thing.
So
So
I'll
I'm just
keep
going
the
to
answer
ask you
short.
on a scale of 1 to 10,
Yeah.
how important these things are as far
Okay.
as trying to prevent a heart attack, a stroke, anything that has to do like with vascular stuff. Just interesting. So honest, just on a scale of 1 to 10, omega threes.
7.
Fixing your microbiome,
2.
exercise,
9. 10.
statins,
10.
niacin,
0.
sleep.
Oh, I'm torn on that one. I would say 5. The only reason I say, because you and I, they're like, if sleep was that important and stress, you and I would have been dead a long time ago. So that's for the caveat. I always tell people it's,
Stress was my next one. So I'll take that as a 5. Diet.
oh, I think that's huge. It's 8 or 9.
And then the last thing I'll ask you, this isn't a numerical question. What's more important, genetics or, and this isn't exactly, I mean, this is whatever, this is inside baseball, genetics, or is it epigenetics?
Well, I think epigenetics is such an esoteric
Yes. That's why I said that. I
term,
said it's
and
inside
and it, and
baseball.
it's evolving field. I don't like it, and I don't, because immediately when people start saying epigenetics, I say charlatan.
I love
Okay.
mitochondria. I am a mitochondrial expert. I will say that. So I'm just gonna. I'll push back a
But
little. I
no,
will.
but you're also, but I'm not,
Yeah. No, no, I
I'm
understand. I
against it.
understand. I
Yeah.
love everybody. Everybody's
But I'm
watching the
saying,
show. They're like, "Oh my God, Sinicropi, mitochondria."
no, but
I
you
have
are,
textbook. I have textbooks this thick on mitochondria. I'm like
right.
obsessed with mitochondrial function. Go ahead.
But you also a neurosurgeon who studied and know it. I'm talking about the charlatans
I got you.
who use
Yeah,
those bullet points or the chiropractors. So I
yeah.
say epigenetics is one of those words where the majority of the people who use it don't even know what it means. So let's talk about just your genetics because your
Right,
genetics are your genetics are most important. You know, so many cancers have a genetic component,
right.
BRCA1, BRCA2. Cardiovascular disease, it's genetics, genetics, genetics. The most common genetic disease in the United
Yep.
States is heterozygous familial hypercholesterolemia, 1 in 600 people. 1 in 600, you
That.
know.
All right. So last question, and then I really want to educate people on how they can find you because you have you're a treasure trove of information. It'd be amazing. So I just want to make sure they get all that information. This is going to be real simple. I think I know the answer to this question already, but I just just jotted some stuff down. If you could put up a billboard, all right, you got. I want this. If you could put up a billboard that every American would see on their morning commute, what would it say?
Um, it's an interesting question.
I knew it. This is that's why I saved the best for last.
Well, I mean, there's a couple that I've thought about.
Yeah, you could give me two. I mean, listen. You can give me two.
And I'm not saying this from ego. Call Paladin MDs. We just may save your life. Okay.
All good. I love it. Yes.
Um, that and you don't need to die from heart disease. Um, Call me or call Paladin MDs because you don't. You don't. And as you know, I'm not selling any gimmick. I'm not selling shit. Like there's nothing. I mean, I wish I was that guy who could endorse stupid shit. And my life would be a lot better, but I can't. So all I'm selling is knowledge. LabCorp doesn't make any money from me. I'm selling knowledge and I want to keep you alive. So it's basically you don't need to die from heart disease. Call us, but you also don't necessarily need to die from cancer if you have the right direction, and you don't have to be paralyzed from cervical stenosis. If you start, on a lot of these things, you only have one shot. And if you don't do it right the first time, it's never going to be okay.
Yeah, I thought so. Yeah, that was right along the lines that I thought you were going to say. I thought you were going to just say a big billboard. Everybody go out and get your, particle number testing, something like that. It's along the
Well, you know
same.
why I
It's
saw that? So it's so funny. It's so the guy from the East Coast, I told you, the abrasive lipidologist who everybody knows in the world. Um, I had spent we don't have the same political views, but he helped make my career. Dennis Prager, I was on, did a lot of his shows and went on for an hour, and we just ad-libbed it because he finally understood the particles. He went to a doctor, and everything was destroyed, and didn't know. Told him his cholesterol wasn't bad, and it was a disaster. So Dennis became one of my biggest fans. So, I mean, I think my website had 65,000 hits in a 24-hour period. But um, um, Dennis would just tell people his motto is just tell you need to have your cards drawn. So this lipidologist, the abrasive Jersey guy, is in a Lincoln Town car, I think going from Tucson to Phoenix with one of his talks, and he goes, hey. So I heard this cardiac surgeon, Dr. Richman, and Dennis Prager saying you should have your cars drawn. What about that? And he goes, I taught that shit everything he knows, and he got totally abrasive. He's like, dude, you're on the radio for 1 hour, and you've reached more people than I've reached in 20 years of lecturing. and it was like, okay, sorry, like apologizing. But the truth is, you need to have your cards drawn. It identifies. And if you don't want to take medicine, everybody, okay, that's your call. But as time moves on, you need to start young. So babies have yellow streaks in their aorta. The sooner you start with medicine and the longer you take it, you don't need to die of a heart attack. You don't need to die of a heart attack,
And
and or a
I
stroke.
think I love it. I think it's great advice. And like I told all of you that have made it to the end, this man is going to save I mean, he's going to save your life. I mean, these are life-saving. This is easy. It's an easy test, $100. Ask your doctors about it. Again,
Well,
this is,
insurance covers it. Medicare pays for
you
it,
know what, for $100, if it's going to save you from a heart attack, I think people should be able to.
Yeah.
Most people, like, listen, when it's thousands, but if $100, get the test. I don't care if
Right.
I just get it. Just get the test, because 50%
Right.
of people that are having these events have normal, LDL, and that
I mean,
if that's
everybody should either have
yeah.
an LDL-P testing by NMR, that's what I do from LabCorp, and an apolipoprotein B, and then one time in your life, you don't need them over and over, but a lipoprotein little a. Those three things. And I can't tell you blood test that is more important that provides you with more information. There is none.
And it's great advice. And unfortunately, when they go to their doctors, this is, and unfortunately, in many cases, not the advice that they're getting. I mean, it's just not. And it's based on hardcore science. So, as we
Yeah.
wrap it up, listen, anyone that listened to this episode has learned a ton. I'm sure they're going to want to learn everything about you. They're going to definitely want to know how to reach you to be their quarterback when they're in trouble. I certainly would. If I had an issue, I would just reach out and say, hey, can you, I know I'm a
Yeah.
surgeon, but I don't feel good. Can you please help me get through this, please? So just tell us everywhere to find you, social media
Okay.
handles, whatever you think is the most,
Okay.
like where
So
you
my
want to be
company,
contacted.
so my company is Paladin MDs, PALADIN MDS, and the website's www.paladinmdsmds.com. And we do lipid consultations, and you'll see. It's a really easy website to navigate, but there's a lot of knowledge there. Um, um, I am on Substack. I've written about 170 or 80 articles on everything cancer and nutraceuticals and empathy and physicians, and
I
you name
love it.
it. All different topics, do videos, and that's DOC, the number four, heart, HEART.substack.com. I do educational videos on TikTok, and believe it or not, I love it. Doing these videos, and that's at Doc4Heart. I'm also on Instagram at Doc4, the number four heart, HEART, Paladin MDs. Um, and then if you want to see pictures of my dogs and all that, that's on Facebook. I have two golden retrievers. Um, and then YouTube and stuff. But really, it's I take my company and in my articles that I write on Substack, and um, the TikTok thing I'm really enjoying because I have so many people write. There's no doctors on here that are willing to listen to me or even give advice or give, like, I mean, you've seen my lectures. I do 5 or 6 minute lectures on the five things you need to look at. What are the warning signs for colorectal cancer? Or should you that needle directed biopsies do not spread cancer, common myth. And then I have all these people argue with me, and I actually respond to everybody. So I enjoyed this, though. I really did. I enjoyed this a lot. Thank you so much.
This was honestly, this was amazing. I mean, just like the amount of information that we covered here in our 2 hours together. Again, the most important thing is if it saves people's lives.
I
That's
agree.
what it's all about. I mean, this is life-saving stuff. This isn't like, hey, we're trying to increase your energy levels a little bit. I mean, this is like, don't
Right.
die. I mean, you're giving the message like,
Right.
don't die. By the way, your TikTok, like everything you do online is so educational. It's awesome. I love following you. Obviously, we've corresponded and things like that. I mean, it's great stuff. It's so well polished, and it's just it's coming from such a deep like just a deep understanding of these conditions. And in some ways I'm jealous because I do a lot too on social, but a lot of times I'm so unbelievably overwhelmed with stuff. I'd love to just sit down sometime, like for like weeks and
But I wouldn't
just
say
do that.
polished. Don't give me that much credit. Like I literally wake up in the morning,
But it's
I
great. But
feed the dog, I have coffee. I don't even know. I stick on the
I
phone and
love
I
it.
like I'll think of the night before, I'll think of some topic, and I'll read like a paper that I wrote or whatever, and I'll just do it. And I'm like, okay, is my hair okay? I'll scrub and scruffy and like I'll have some stupid comments. I don't want to go to a doctor who hasn't shaved. And I'm like,
That's it. There's only like
and then my mother's like, couldn't you have shaved? And I'm like, click,
No,
click,
it's excellent. No, it's good. No, don't listen. Don't knock your stuff. Your stuff is highly
Thank you.
educational. It's really good. And again,
Thank
it's
you.
coming from an expert that cares, wants to save people's lives, saving lives. I mean, you talk about prevention, you talk about other stuff. And yes, if they want to go find your dogs, go ahead and go to Facebook and
Right,
get a little bit more of the
right.
touchy-feely stuff. But anyway, this has been incredible. This is one of I think this is going to be one of the most watched episodes of wellness
Oh, that's
at the
great.
speed of light because it's just a treasure trove of information, and we're going to break it up into shorts, and people are like all these like just you were just dropping just like amazing nuggets. I'm really excited about that. So everyone, thanks for sticking in with us. Thanks. Obviously we got into a little bit of the inside baseball stuff. Some people I'm sure
Right.
fast forward that a little too deep for some, but for those of you that enjoyed us, please let us know in the comments. This has been a pleasure. I'm definitely going to have the doc on again because this is, I'm sure they're going to be asking for you to come back on the show. Listen, everyone, go get your testing. He told you what exactly you need to do. Don't unnecessarily die of a heart attack or a stroke because you didn't take a very simple step
Right.
to prevent disaster. And we could talk about so many other
And
diseases where,
obviously, I do the
yeah.
lipid consultation. So if you go to the website, you can book a lipid consultation. You send me your insurance information, your date of birth, and your address. You'll go get your blood drawn at a LabCorp by you, non-fasting. By the way, that's another fallacy. You don't need to fast for your lipid testing or any blood draws, to be honest with you. Um, and then we set up a time and we talk on the phone and we go over it. And then your doctor will implement what I say. And if he doesn't, I'll find you a new one who will. Simple as
Bingo.
that.
Love it. Yeah, like I said, if you don't like your doctor, fire him. I think that's the name. That's the
Right.
name of the game. So thanks
Right.
everyone for being on another episode, Wellness at the Speed of Light podcast. I just love doing this, especially when I can have a conversation that I wish was going to go on for another 3 or 4 hours because, we could cover so many other topics. Thanks so much, doctor, for being on the program today. And we'll see you guys on the next show.